Disclaimer: this video is for informational purposes only and is not a substitute for professional medical advice. If you have concerns or specific symptoms, always consult a doctor. Hello and welcome to Health Pills. Today, we will explore 10 important body signs and symptoms that you should never ignore. We won't just list them, but delve into the underlying causes, understanding the mechanisms behind them. By following each point and explanation carefully, you can build a complete understanding of your health. Don't miss the end of the video, where an interesting bonus awaits. 1. Thinning eyebrows. Thinning eyebrows, especially on the outer part, can be an early sign of hypothyroidism, a condition where the thyroid gland does not produce enough hormones. These hormones are crucial for regulating many body functions, including metabolism, heart rate, and digestion. When the thyroid slows down, bodily processes follow, leading to symptoms such as weight gain, fatigue, slow heart rate, and constipation. Hypothyroidism can have various causes, but one of the most common is Hashimoto's thyroiditis, an autoimmune disease in which the immune system mistakenly attacks the thyroid gland, reducing its function. The typical treatment includes synthetic thyroid hormones to compensate for decreased thyroid function. However, this approach does not address the root cause, which is the autoimmune attack. Another potential remedy is iodine supplementation, which is beneficial only in cases of iodine deficiency. Excess iodine can worsen autoimmunity. Identifying and addressing the primary cause is essential to improve thyroid health and reduce associated symptoms. If you identify with these symptoms, it may be helpful to have a thyroid function test. Speak with a healthcare professional for proper diagnosis and treatment. Early monitoring and intervention can prevent worsening of the condition and help maintain a healthy metabolism. 2. Excessive appetite and weight loss. A voracious appetite combined with weight loss. Hyperthyroidism. The thyroid is overactive and produces too many hormones. This accelerates metabolism, leading to symptoms such as a rapid heart rate, excessive sweating, nervousness, and a constant feeling of warmth. Graves' disease is a common cause of hyperthyroidism. Often includes visible symptoms like bulging eyes or an enlarged thyroid gland. Another reason for having an insatiable appetite with weight loss is type 1 diabetes. In this case, the body doesn't produce enough insulin to absorb blood sugar, causing constant hunger and rapid weight loss as cells are deprived of the energy they need. This also results in increased thirst and frequent urination as the body tries to expel excess glucose through urine. Regardless of the cause, excessive appetite accompanied by weight loss requires immediate medical attention. Identifying the underlying cause is crucial to start the correct treatment, which could include antithyroid medications, radioactive iodine therapy for hyperthyroidism, or insulin for type 1 diabetes. Recognizing these symptoms early helps prevent long-term complications and improve quality of life. 3. Slow wound healing. If you notice that wounds, particularly on the feet and lower legs, take a long time to heal, uncontrolled type 2 diabetes. Diabetes causes high blood sugar levels, which can damage blood vessels and slow circulation. This impedes the body's ability to deliver oxygen and nutrients to damaged areas, slowing the healing process, increasing the risk of infections. Excess sugar in the blood causing swelling and cell damage, reducing blood flow and the supply of oxygen. This not only slows wound healing but also increases the risk of diabetic neuropathy, a condition where damaged nerves fail to send the necessary signals for regeneration and healing. Slow wound healing is a warning sign indicating poor diabetes management requires urgent action. Treatment focuses on controlling blood sugar levels. Strict blood sugar control is essential to prevent further complications, such as foot ulcers that can lead to amputations. If you notice this symptom, consult your doctor for a thorough checkup and a personalized management plan. 4. Coated tongue. A coated tongue with a white or thick layer could be a clear sign of a candida infection, a type of fungus that overgrows when there is an imbalance in the gut's bacterial flora. This condition, known as gut dysbiosis, can be triggered by a diet high in sugars, antibiotics, or a diet low in fiber and nutrients. An overgrowth of candida, it can impact the entire digestive system, causing bloating, gas, and digestive issues. The role of the gut microbiome is crucial for overall health. It regulates digestion, nutrient absorption, and immune response. When the microbiome is imbalanced, the beneficial bacteria that keep fungi like candida in check become overwhelmed. The result is uncontrolled fungal growth, which can manifest as visible symptoms like a white-coated tongue and systemic symptoms like fatigue and irritability. Addressing this issue requires more than just antifungal treatment. Tackling the root cause, which may include an imbalanced diet or stressful lifestyle, is essential. Reducing sugar intake, increasing probiotic consumption, and eating whole foods can help restore microbiome balance. If you notice a coated tongue and related symptoms, consult a doctor or nutritionist for personalized advice on restoring gut health. 5. Apple-shaped body. Carrying excess weight around the midsection, creating an apple-shaped body, is a concerning sign of visceral fat. Visceral fat surrounds internal organs and releases inflammatory molecules and hormones that can disrupt metabolism. This type of fat accumulation is often associated with high cortisol levels, the stress hormone, and increased insulin resistance. An apple-shaped body is not just a cosmetic concern but a sign of serious health risks. This type of fat is linked to a higher risk of heart disease, type 2 diabetes, high blood pressure, and metabolic syndrome. Insulin resistance occurs when the body's cells no longer respond effectively to insulin, leading to higher blood sugar levels and further accumulation of visceral fat. Addressing this problem requires a holistic approach. Reducing sugar and refined carbohydrate intake, increasing physical activity, particularly aerobic and resistance exercises, and managing stress are key components. Quality sleep also plays an important role in regulating hormones related to weight. If your body shows this shape, taking action early can prevent serious complications and improve overall health. 6. Loss of arm swing. Arm swing is a natural and automatic movement when we walk. Loss or reduction of this movement can be an early sign of neurological degeneration. In cases of Alzheimer's or other forms of brain deterioration, coordinated and automatic movements may begin to diminish. The brain can no longer efficiently send signals to the muscles. Arm swing is managed by a complex system of reflexes involving the brain and spinal cord. When neurological function is compromised, motor signals may become weak or inconsistent, reflected in how we walk. If you notice reduced arm swing, it is important not to ignore it. To counteract this degeneration, it is helpful to engage in brain-stimulating exercises and regular physical activity that encourages coordination and symmetrical movement. Practicing activities such as brisk walking and strength training can help maintain healthy nerves and muscles. If you have concerns or notice changes in your movement, a neurological evaluation is recommended to assess the situation and start preventive or therapeutic measures. 7. Loss of smell. A gradual loss of smell, especially when not related to temporary infections like a cold, can be an early sign of Parkinson's disease. This neurological disorder affects motor control and, in advanced cases, can impact thinking and speaking abilities. The part of the brain involved is called the substantia nigra, responsible for producing dopamine, an essential neurotransmitter for movement and balance. Dopamine acts as a chemical messenger, helps transmit signals in the brain to coordinate movements. When dopamine levels decrease due to the deterioration of the substantia nigra, symptoms such as tremors, stiffness, and slow movements start to appear. Loss of smell can be one of the earliest signs, occurring years before visible motor symptoms. A persistent reduction in smell stiffness, slight tremors, or changes in posture. Pay attention to other related symptoms. Although there is no definitive cure for Parkinson's, early diagnosis and treatment can slow the progression of the disease and improve quality of life. Physical activities such as Tai Chi and coordination exercises can support motor function and help keep the brain active. 8. Snoring. Snoring is often seen as a mere annoyance. Reduced muscle tone in the soft palate area, causing the snoring sound as air passes through. This condition can be linked to a weakening of the vagus nerve, which controls the muscles of the palate and many functions of the parasympathetic nervous system. The vagus nerve is the 10th cranial nerve and plays a crucial role in keeping the body relaxed and balanced. When this nerve does not function optimally, issues such as snoring or, in severe cases, sleep apnea, interruptions in breathing during sleep, can occur. This can lead to poorer sleep quality, daytime fatigue, and long-term cardiovascular problems. Exercises like singing and gargling with water are useful for improving muscle tone in the palate, stimulating the vagus nerve. These activities help strengthen the involved muscles and improve breathing control during sleep. If snoring is accompanied by pauses in breathing or frequent awakenings, it may be necessary to consult a specialist to assess for sleep apnea and consider appropriate treatments. 9. Dizziness when standing up. Feeling dizzy or lightheaded when standing up quickly can be a sign of adrenal fatigue. The adrenal glands produce essential hormones like adrenaline, which help maintain stable blood pressure when moving rapidly from a seated or lying position to a standing position. When the adrenal glands are tired or not functioning properly, they cannot produce enough adrenaline in time to maintain adequate blood circulation to the brain, causing dizziness. Adrenal fatigue is often the result of chronic stress, an unbalanced diet, and lack of sleep. When the adrenals are under constant stress, they lose their ability to respond adequately, causing symptoms like fatigue, weakness, and poor concentration. While adrenal fatigue is not universally recognized as a medical diagnosis, its symptoms are real and can significantly impact quality of life. To improve adrenal function, it is essential to adopt a healthy lifestyle that includes a balanced diet, moderate exercise, stress management techniques like meditation, and quality sleep. Reducing stressors and taking time for recovery can help the adrenal glands regain their function and prevent episodes of dizziness. 10. Hand position when relaxed. The position of the hands when relaxed can reveal a lot about the state of the nervous system and muscle stress. If you notice that your hands, when left free at your sides, are rotated inward, it may be a sign of an imbalance between the shoulder flexor and extensor muscles. This imbalance is often caused by the dominance of the sympathetic nervous system, which is activated during stressful situations and can lead to a defensive posture. The body assumes a protective position, the shoulders lift and lean forward, the hands rotate inward. This natural reflex, useful in dangerous situations, becomes problematic if maintained over time. It can lead to chronic muscle tension, neck pain, and posture problems. Constant stress prevents the parasympathetic nervous system, responsible for relaxation, from rebalancing muscle tension. Practicing exercises for shoulder extension and external rotation, stretching with a resistance band. Additionally, relaxation techniques such as deep breathing and yoga can help reduce sympathetic nervous system activation and improve posture. Mindful attention to daily posture and incorporating active breaks during the day can help maintain muscle balance and prevent stress-related pain. Bonus: loss of impulse control. With age, a loss of impulse control, sudden outbursts of anger, unwarranted stealing. This phenomenon is often linked to the degeneration of the frontal lobe of the brain, which regulates emotions and behavior. The frontal lobe is essential for our ability to plan, inhibit impulsive reactions, and maintain appropriate behavior in social situations. As we age, brain connections may deteriorate, significantly reducing impulse control. This process is similar to what happens in young children whose brains are not fully developed. The ability to inhibit impulses and control emotions grows as the brain develops and stabilizes, reaching full maturity around the age of 25. In old age or with degenerative conditions, frontotemporal dementia leading to childlike behaviors. A decline in impulse control can be an early sign of neurological conditions such as frontotemporal dementia. When the frontal lobe deteriorates, a person may become more irritable, impulsive, or even start committing small acts of kleptomania, even when they can afford to buy the items. This type of behavior can be distressing, confusing for both the affected person and their family, represents a significant change from their previous behavior. To maintain frontal lobe and overall brain health, it is crucial to lead an active and stimulating lifestyle. Mental exercises, regular physical activity, and a nutrient-rich diet help preserve cognitive functions. Engaging in brain-stimulating activities such as reading, solving puzzles, and socializing can help slow the decline in impulse control abilities. Managing stress through meditation or mindfulness can also help keep the frontal lobe in good condition and promote greater emotional stability. Conclusion: understanding the signs and symptoms your body presents can help you prevent and address potential health issues before they become serious. From identifying early indicators of thyroid imbalances and diabetes to recognizing neurological concerns and other health red flags, proactive awareness is essential. Taking these signs seriously, maintaining a balanced diet, managing stress, and staying active are crucial steps toward better health and wellness. Remember, the key to longevity and well-being lies in prevention and early action. Regular checkups, a supportive lifestyle, and seeking professional medical guidance when needed can make a significant difference. Thank you for watching Health Pills. If you found this video informative and want to learn more about how to take control of your health, don't forget to subscribe to the channel. Give this video a thumbs up and hit the notification bell to stay updated with our latest health insights. Take care and see you in the next video.